Hello, I'm Dr. Mary Beth Flaws. I am the department chairperson of the Department of Medical Laboratory Science at Rush University Medical Center in Chicago. And I have been invited here to talk about converting students completing their clinical practica in your laboratory to employees. So the learning objectives for this session are that I hope after listening to this, you will be able to list the characteristics of a laboratory that are rated most important by graduating students as they consider where to work. I'd also like you to be able to identify 2 areas of importance to students that can be enhanced in your laboratory so that students will choose you for employment. And third, appreciate your students as customers and potential employees and emphasize their needs to your current employees who are involved in their recruitment through their teaching. So, a little bit about our program at Rush. We have been a NACLS accredited program, well, since before there was NACLS, but we've had a program since before 1959. We started out as a 1-year hospital-based certificate program in medical technology. In 1973, we adopted the current program model at the time, which was a 2+2 program. So we offered a Bachelor of Science degree in 2 years, again in medical technology at the time. In 2000, we started an entry-level Master of Science program in, actually at the time it was clinical laboratory science, but now medical laboratory science. And the reason why we started the Master of Science program was because we were getting lots of applications to our BS program from people who already had a BS in the sciences or anything else. And they did not come into our program because they did not want a second BS. So we started the entry-level master's program. That program was successful for us, and for a lot of mostly internal reasons. In 2015, that was the last year we admitted students into the bachelor's program. And so since 2016, we have been admitting students exclusively into the Master of Science program and currently graduate around 20 students per year. So kind of a medium-sized program, I think. Um, we use Rush University Medical Center as a clinical site, but we also send students to the other large tertiary care medical centers in the Chicago area. So Lurie Children's, the University of Chicago, Northwestern Memorial Hospital, and the University of Illinois at Chicago Hospital. We use a couple of other clinical sites, but not regularly and usually just for one student. So our main clinical sites are those that are seen here. So to those who are in a hospital and you serve as a clinical practicum site, thank you. It is critical for students coming into the profession to have that clinical practicum experience in a real working hospital laboratory. There are ways to simulate that, certainly, but we greatly appreciate that you serve as a clinical practicum site. It really increases the educational experience and learning experience of our students. Now, as you know, and probably one of the main reasons why you serve as a clinical site is that it serves as an on-the-job interview of sorts. So you see this potential employee for several weeks, maybe even months, and get to evaluate whether they can fit into your culture. You can look at their attendance and their attentiveness while they're in the laboratory. Do they fit into your laboratory culture? How well do they accept feedback? Do they get upset when you correct mistakes, or are they quick to learn and accept that feedback constructively? And then, how are they learning? Is it easy to teach them? Do they catch on fast? all of those things you want in a new employee so you can move them through the training as fast as possible. But what you might not realize is that the students are looking at you during that same time point and looking to see if they fit into your culture. Do they see themselves as an employee in your laboratory? And hopefully, through my discussion in this presentation, you will appreciate that last aspect of the clinical rotation more, such that maybe you make some changes so that you can convert those students into your employee. So everywhere there are staffing problems in clinical laboratories. We are not graduating enough people from accredited programs to fill staffing needs. And this is something that I take personally, being directly involved in a medical laboratory science program. I'm also currently serving on the board of directors for NACLS. And so I highly value the education that people get in our accredited programs. And I don't want to see, the non-MLS educated, BS prepared personnel getting hired in the numbers that they are currently. I don't want to see that continued into the future. So I'm very sensitive to that. Now, at Rush, we do feel a responsibility to provide graduates for Rush Medical Laboratories. And in 2021, we looked at all of the employees in RML and found that a third of them were our graduates, which is great. We don't have a benchmark where we'd like to see that, but we would like to see more of our graduates stay at Rush. Now, our system, our model is a little bit different. We are a university-based program. Rush University Medical Center is an academic health center. So the university is integral into the medical center, although our program is separate. We don't operate out of Rush Medical Laboratories. We're in the university. So there's a little bit of a disconnect compared to a typical hospital-based program, where the program is based in the laboratories and you really are, your mission really is to educate your future employees. So while we do see an importance for us to provide employees for Rush Medical Laboratories, we are not so embedded and directly involved there. But still, we do want to see more of our graduates stay at Rush. So we started a couple years ago, it became really apparent that our graduates were not staying at Rush. And so we started to look at why was that? And so when we looked at our model, only a small number of our students actually rotate at Rush. So is the clinical site a factor in future employment? And that's kind of what we'll address in our studies here. Some of our students do work in Rush Medical Laboratories while they're students in our program. When we wondered, are they more likely to stay at Rush after graduation because they're already employees there? We've seen kind of mixed effects of that. Yes, some of those students who are already employees in Rush Medical Labs do stay and work, but we've also seen some student employees leave Rush. So this isn't a definite deciding factor in why students either stay or leave Rush. We wanted to know what was most important to students as they evaluated a potential employer, and this is something that we didn't really know. And then we thought, well, should we be asking applicants about their likelihood to work at Rush University Medical Center after graduation? And should that be a factor in our admissions process? Now, to be honest, we don't get more applicants than we have seats. So to start excluding students who say, oh no, I don't want to work in the city after graduation, I know that right now, and not admit them to the program would not be an option for us. But that might be something that perhaps smaller hospital-based programs whose mission really is to educate future employees, that's something that they may want to do and something that they may already do. So we wanted to look at what are factors that influence job decisions. And these are some of the factors just from this one article. Um, and they fall into basically 5 different buckets. So one is internal. So these are things that that applicant is looking for in a job. So some standards of living. So this, gets into the flexibility of the position. Are there opportunities to growth or for growth for that person? Will a job be challenging? Is it peaceful? So these are things that they value in themselves, and then they're looking at that potential job and work environment to see if those factors play out in that job. There are external factors. Oops, I'm sorry. So the location is very important, and also salary. Although in lots of surveys, and you'll see even in ours, salary is not the number one factor for a job decision. Um, so it's kind of interesting. So you think salary is important, it definitely is, but it's not the most important factor that would dictate whether a person comes or goes. Interpersonal is very important. So the family, peer, professional influences on whether a student or an applicant will take a job or even apply to a certain employer. And actually, these first 3 factors are what rank the highest in all of the research that we did in the literature. The last 2, these come into play more for graduate students, and we are graduating graduate students. So institutional factors, those with a graduate degree seem to value the importance and the reputation of the employer more than an undergraduate student. So they're looking for that ability to say, oh, I work at Rush, and everyone to say, oh, wow, that's amazing, because everyone has a great opinion of Rush, or, fill in whatever institution. Also, associate demographic. So men and women have different thought processes, different needs, and they choose a job based on different requirements, and really within the first 3. So the men are more about salary, reputation, whereas the women focus more on the personal aspects of a particular job and whether they can fit in. But we wanted to know, what do MLS students value in a potential employer? As I said, we offer a Master of Science degree in medical laboratory science. And so as part of our degree, students have to complete a research project. So actually what I'm going to explain here today are the results of 2 of our students' research projects. So the first one was just what do our students, as they're getting ready to graduate, what are they looking for in potential employers? So we sent out a survey to graduates of our program, and we had 64 graduates respond to the survey, and they graduated in the years between 1999 and 2022, where most of them skewed toward the 2010 to 2022 years. We asked them several questions, as you'll see, but one of the things that we're going to carry through here is what was the importance of their clinical site in their employment decision. And 43% of the graduates who completed the survey during this time frame ended up taking their first job at their clinical site. So a good percentage, but that will start to show you the importance of the clinical site in their employment decision. But let's look at some other factors. So we asked them to rank these factors, 1 through 6, and then we collated the data and looked at what appeared first. Location was the most important factor. But as you look at these first three factors, and if you take away, the decimals, the first three factors are really the same: location, the clinical practicum experience, and financial motivation is salary. But see, salary is not number one, but it is, these three are very closely aligned in terms of ranking. And then kind of falling farther behind are benefits, personal reasons, for example, being close to family, and then other reasons. You can see that ranked very low and not likely a first choice, but we didn't explore the reasons that came through in other. So we asked these students in the survey, or these graduates really, why did they not stay at Rush? So our program is also on campus. The university and classrooms are located right across the street from the hospital. So they are comfortable coming to that location. They know where it is. They're coming into Rush for a year before they get sent out to clinical rotations. And then if they're not staying at Rumsey, they're going out to other places, which are also not too far away from Rush University Medical Center. So we asked them, why were they not coming to Rush? Many of them said that the salary was lower. So yes, I said that salary was typically not the number one factor, but when we asked the questions of the graduates at this time, this was graduates who graduated 2022 and before, the salary was lower. And the graduates of, I think, 2021 and 22, maybe going back to 20, very few of them, like one or two out of 30, 40, actually stayed to work at Rush University Medical Center. And a lot of it was about salary, and salary definitely was low at that time. Since then, so in 2023, they raised the salary for the laboratory personnel to be much more competitive with our other hospitals in the Chicago area. And as a result, we're seeing more graduates stay. Also, that improve the retention of our current employees, which is another huge factor. Why not Rush? Many of our students did not like the location, so they did not like coming into the city. We're just west of downtown Chicago, but they lived in the suburbs or wanted to live in the suburbs, and they didn't want a long commute. And there's, not much we can, well, not anything we can do about that, right? For some of the people, depending on when they were graduating, there were no open positions at the time they graduated, so they could have or maybe would have stayed at Rush if there was a position. And then the last two factors are, something we're going to talk a little bit more about. Not so much poor management, but that was definitely a factor of why they were not coming to Rush, and then a toxic environment. Now, I did tell you that, say, out of about 20 students in our class, 5 or 6 of them will stay and rotate at Rush, and we'll send out the bulk of our class to the other hospitals. So even though few students rotate at Rush and see that direct environment and witness, say, that toxic environment, they talk to their classmates. And when their classmates say, "Oh, I'm thinking about working at Rush," and their classmates have rotated at a different hospital, the ones who rotated at Rush would say, "Oh no, I don't think you should. It's a horrible place." And that's what they were saying at the time. So just because only a few of them maybe experience this, they talk about it. And so more and more, or, like the whole class will have that impression, whether it's true or it's not, because it is based on personal opinion. So because the clinical practicum ranked high in the decision making, and it's something that we have control over directly in the program, we wanted to look at what influenced student satisfaction with clinical practica. Every rotation, we do a survey of our students right after they finish the rotation and ask them what they thought about the rotation. And so we had one of our graduate students not too long ago look at those results and analyze those results with an eye toward what influenced student satisfaction with clinical practica, because that seemed to be a very important factor of whether that student would stay in that hospital as an employee. Overall, the students were content with their clinical practica, so there weren't, big, huge differences, but we were able to pull some things out. So, some positive comments or some results from the survey that were associated with more satisfaction is really about the staff, that interpersonal communication, relationship is key for making a positive experience and increasing the satisfaction of students with that clinical practicum. So the staff is willing to help them learn, willing to answer questions, their attentiveness to the students. Because if the student feels secure and feels that someone cares, their learning is better. Um, and then sensitivity to student needs was very important to those students. It helped them learn more. It helped them be more satisfied with the rotation. And then the thought is if they're more satisfied and they like that clinical site more, they're more likely to stay as an employee. Staff is knowledgeable, helpful, encouraging. These are all terms that the students wrote in the surveys. And so what we take from that interpersonal relationship communication is really huge to making the student feel comfortable. And then being provided positive feedback and non-threatening communication. And I'll talk some more about that. But these were all associated with high satisfaction with that clinical practicum. Some other things, if the student knew what was going to happen to them in the day, in the week, so a clear schedule and expectations, that was very important to the students. It was also important that the staff knew what we expected of them as a program, because if the staff didn't know the schedule and didn't know that they were going to be teaching a student that day, their attitude about that student was not very positive, and the student knew it. And then that did not lead to a positive experience by the student, as you would expect. And then anytime the staff could motivate the students to do their best, be their best, was associated with positive satisfaction. Now, some of the negative comments. So if the students did not like the rotation, look at, again, it's about the environment and about that interpersonal relationship. The students would call out the toxic environment when they saw it. And it wasn't just the toxic environment of the staff in relationship to the student, but they would watch how employees treated each other. And if they saw mistreatment, if they did not like that relationship between employees, that led to their lack of satisfaction with that rotation, and thereby their less likelihood to look at that site for a job. The lack of professional or supportive behavior, again, either toward the student or toward each other within the laboratory, was called out as being something that led them to be not satisfied with that rotation. If the students felt rushed or pressured, which sometimes is hard not to do if the workflow is very busy. There's a lot of stats. We always tell our students the patients come first, they're second. But if the students can't get past kind of that rushed environment, they don't learn so well, and then they're not satisfied with the rotation. If students feel that they're providing free labor, that is not satisfying to them. Yes, they want to learn. Yes, they want to have the hands-on, because you'll see that come up next. But they don't want to feel like you're giving them, whatever you don't want to do and just having them do it, especially if it's having them being sent away from where, all the action is in a way, that it will lead them to be not satisfied. Now, the lower rated laboratories are typically, at least in this survey, are the ones with more automation: hematology, chemistry, immunology. And we've struggled with that. So how can we advance that? Because we recognize that it's boring just watching, right? Too much observation. It's boring. There's not enough hands-on. And we agree that that would be very boring. And it doesn't, it's not conducive to learning. So we've been looking at ways to make that more engaging. I have some ideas coming up, but certainly this is an area where we need to do more work. Some other negative comments: if students are given tasks and the students know that this is busy work, and especially if they're told to, here, go do this, and it's away from whatever the technologist, the MLS they're assigned to work with is doing, that leads them to be not satisfied. And the students know that it is busy work. Now, sometimes you could say, okay, the students need to review slides in hematology and look for normal, abnormal cells and do some differentials. But it needs to be presented in a learning framework, instead of, oh, here, go do this because I'm too busy to deal with you. Okay. And then in general, if the laboratory environment is not conducive to their learning, um, like the positive and the negative comments all go together. So if the student is not engaged in laboratory operations and the student is just kind of following, they're just that shadow, and they're not being engaged in what's going on. And really, the MLS at the bench just needs to talk out loud about what they're doing, what they're thinking, what they're looking for, and tell that to the student. Um, that goes a long way to making a positive experience. So, kind of putting it together, and looking at the employment and what the students liked or satisfied them the most about their clinical experience. So, from the employment survey, we found that location is very important to the students. They rated that number one. Most of them rated that number one. Now at Rush, right now, we don't have the luxury of sorting out students who want to work at Rush, but we also don't see it as our program mission to provide exclusively employees for Rush University Medical Center. We look at our mission to provide graduates to the profession more globally. But if you're working in a hospital, you've got that hospital-based program, and you're admitting 5 students and you want them all to be an employee when they finish the program, then you might sort out your applicants based on whether they say that they would be interested in working in your hospital after their education is complete. Salary was rated number 3, so again, very high, not number 1. And those first 3 choices were all very closely ranked. But salary is important. People look at salary. We found that it was huge for retention, because when we raised our salary to be competitive with our competitors, we were not losing people to our competitors. So as laboratory managers, we need to advocate for laboratory personnel to have bumps in salary as our competitors raise salary, so that we're competitive and we don't lose those we've trained to the other hospitals, and we can keep the ones we've taught in our clinical experiences. Benefits rated number 4. I kind of wonder if students understand the value of benefits. We did specify like tuition reimbursement, paid time off. Do they really compare those? I'm not sure about that. But given a location and a salary, the experience in the clinical site, I mean, not everything can be ranked as number 1. And then number 5 was some personal reasons and other factors, which I didn't pull out here for you today. So the clinical practicum experience was rated number 2. And since those, 1, 2, 3, location, clinical experience, salary were rated so closely, we can't do anything about the location. And if you're a manager in the laboratory, you can do something about the salary. But from the program perspective, I can't do anything about the salary. But what I can do is work on making that clinical practicum experience the best that it can be. And if we can improve that clinical experience, that should lead to converting that clinical practicum student to an employee. So how can we do that? And what do students want? All right. So in thinking about that, I was thinking about from our perspective in the program, maybe yours too in the clinical site, what is the purpose of that clinical practicum? Why do we have students go out into the laboratory? And I came up with 3 different things. So, and there are more, but it reinforces the knowledge that's gained during their didactic courses, during their student laboratory. They get to see all of those things we've talked about in operation. How do those tests get used and interpreted? How are they performed on those large analyzers? It exposes the students to the real world work environment so you can see the hubbub and the interaction between people, both laboratorians on laboratorians, how we interact with our clinician colleagues and all the other people involved in healthcare. And another important purpose is to demonstrate and also develop the critical thinking skills. So, what are the employees, laboratorians thinking as they're looking at results? Do they make sense? And how do they establish that those results make sense and then release them into the patient record? So, kind of putting everything together and making an environment conducive to learning, because that is what came forward in both the positive responses and the negative responses. So if the students felt like they were in a place where they could learn, felt supported in their learning, they rated that experience highly. Whereas if the environment was not conducive to learning, that was associated with their lack of satisfaction. So how can we do that? Reducing stress or pressure felt by the student. So the students are nervous, right? And they're still in the process of learning, and we need to realize that and maybe recall how we felt when we were first learning. And then supporting them when they have a wrong answer. Say, oh, yeah, that's what I used to think, or I thought that when I was coming out of school and coming into the laboratory. But the way it really goes is this. So not, justifying where they are in their learning and realizing that they are not you with 10 years of experience in this one laboratory. They've had, some couple months exposure. They're just learning this. They're going to have wrong answers, but don't make them feel like they're stupid when they say that. Say, no. I understand where you might think that, but no, this is where you need to go. Engage the students in operations. This is so important. It came through in both the positive comments and the negative comments. So how can we do this, especially when there's automation? So as we're working, we're thinking about things. Yeah, the automation is taking care of the boring stuff, moving specimens from one place to another, loading it into the analyzer. But what are we thinking as we're looking at all of that? All we have to do is talk out loud. So what are we doing? What's our role when automation is doing all the testing? Explain that to the student. I bet you could make that automation more exciting if you explained what your role is in that environment. Discuss troubleshooting when problems occur, because problems always occur. That's what you're looking for, right? So talk about how you figure out and how you solve those problems. Let the students perform the QC. Let them perform the daily maintenance. Show them how to one day, explain the importance of it. Let them do it the next day with your supervision. Don't send them away from the analyzer. Yes, they are with you all day, and that can be difficult. But this job of the student is to learn. They can only learn if they're in the place where the learning is happening, right? Don't send them away to do busy work because they know it and they don't like it. Ask questions. Assess their knowledge. Where are they in their knowledge of hematology or chemistry or wherever you're working, and then fill in the gaps. So they need to get to that higher level, so they know some level coming out of the classes. Maybe it's not even enough. Maybe they're lower in their learning than they kind of should be. So help them get to that next level. That will make an environment much more conducive to learning and much more rated as a satisfactory environment. The staff attitudes are huge for the students, and you've probably seen that in your employees. Employees will say that they're leaving a laboratory because they don't get along with other people, and it always seems like the bad apple stays and all the good apples leave, right? But what can we do with staff attitudes to influence and make a positive experience during the clinical rotation? So again, it's not just staff to student interactions. Those are huge, but the students watch how the staff interacts with other staff members. And if they don't like what they see, they're not likely to want to work there. We need to remind the staff, and probably often, that one of the purposes of the clinical practicum, probably the most important, is for student learning. But the reason why you have students coming in and learning in your laboratory is because you want to bring them in as an employee. When we have the clinical sites reach out or hospitals reach out to us and say, "Hey, I want to be a clinical site for your students," it's because it gives them access to students and hopefully the ability to convert those students to employees. That professional positive behavior is critical for having a positive student experience, and we need to foster that. And also team building. We have a student this year who's going to look at some characteristics of team building on clinical laboratory experience as a guide to not only helping with increasing the student experience, but also helping with staff retention, which is just as critical, maybe more critical now. Students can sense when they're working with someone who does not want to teach. So if we can tell people that and say, teaching is part of your job, which it is in an academic medical center. And also part of your job is to recruit more employees. You need to, um, you know, push back on your lack of willingness to teach for the greater good of the laboratory, I guess is the best way to say it. And then be helpful and engage the student in daily work. This is really important. And I think doing this makes your job in teaching more interesting as well. Let the student help you with things. Let them go get supplies or do a particular test, or um, and then work together to get your work done is going to make your role as a teacher much better, as well as the student experience much better. So these are some of the comments that came through as being rated the highest when students said that they were satisfied with the clinical practicum. If the staff was willing to help and answer questions, they were knowledgeable, helpful, encouraging. Now, sometimes I found that if you have a newer employee, maybe they're not as comfortable with their knowledge level. And sometimes that comes through. They're not as confident themselves. And so to have someone asking them questions. But the way I would turn it is spend the time and look up the answers together. That can help with increasing the confidence of your staff and increasing their positive interaction with that student. I think empathizing with the students and their status as learners can help a lot. And I have to do this as a teacher. I've been teaching for a lot of years. I know a lot more than the students, but I have to think back to, okay, how did I feel when I was first learning this? What helped me as I was first learning this? And then taking myself back to that point, I can empathize where my students are and then help them to get up that ladder of learning. Also, in their staff, I always, and I think most people do this, model behaviors you liked in your teachers, and then definitely don't do the things that you don't like. So we would have staff who had terrible, or like students who had terrible experiences in the clinical lab. The staff, didn't treat them professionally, positively, and they hated it. And then we would find, to our chagrin, that that student who became the employee would do the same thing to other students. So um, instead of not doing what they didn't like, they were doing what they didn't like. It's like, no, you hated when the staff treated you this way. Why are you treating other students this way? And I think calling them out positively, I think can help with that, help change their attitude. Allow the students to perform tasks. They want to do something. They don't want to sit and watch. Sitting and watching someone over and over and over for days on end is really boring. I would be really bored. You have to let them do things. Yes, they're going to have to watch how to do it, but as a teacher, you need to see how they do things so that you can correct them if necessary, and you know, encourage them if they're doing it correctly, and then move on to the next level. And then recognize that the student is a potential colleague. So if your staff is complaining about being shorthanded all of the time, say, hey, here's some students, we're going to train them, and we want them to work here. So we need to do whatever it takes. And maybe it's the drink the Kool-Aid of our laboratory, but we want them to stay as an employee so that you're not working all of this overtime and, double work. So some more about staff attitudes. Allow for student mistakes. The students are learning. When you're learning, you make mistakes, you do things wrong, and that's okay. And I think I tell the students I like when they make mistakes, because then I know that they don't know how to do something. And then it's my opportunity and their opportunity to learn, because you never repeat a big mistake. You learn from that. Show an interest in the student. Tell stories. Again, it's that interpersonal relationship. Yeah, you might only have that person for one day, but get to know them a little bit. Find out what they like, what they don't like. Why are they choosing this profession? And don't tell them that it's a terrible profession. If you think that, I'm sorry, but don't tell that to the students, because they have different reasons for choosing it. They're going to find out what they like and what they don't like about the profession. And you telling them that it's terrible and questioning their decisions doesn't help. So there were a couple other studies on clinical satisfaction that we looked at, and these studies all said the same thing, that the clinical rotation environment was very important in a job choice, that it is a recruitment opportunity, and encouraging staff to give positive feedback to the students makes the students highly satisfied. They feel like they're learning and they feel supported in their learning, and that's really important. So, what are some possible solutions to some of the big problems besides just talking to your staff and encouraging them? Should you have dedicated teaching staff? Sometimes this is done. I've seen this done more in blood bank, at least at Rush. The benefits is, you have someone who likes to teach, who's good at teaching, who's knowledgeable, who understands how to teach. And teaching at the bench is not, it's not formal teaching, and it's not that hard. I think all you have to do is verbalize what you're thinking, and that's how you teach. But the cons of having this is you reward someone kind of who purposefully, perhaps, gives a bad experience. So, someone who doesn't want to teach is not going to do it well. And then you reward them by saying, okay, fine, you don't have to teach. And when you're at an academic medical center, part of your job expectations is that you will teach. So, yes, you're not going to make great teachers. You're not going to get rid of complete bad attitudes. Maybe you can ask people to stuff it a little bit and hide it. But you're going to have to tell them that, yeah, good or bad, you're going to be teaching. Encourage students when they're first starting in your laboratory to identify their strengths or weaknesses. If you have some flexibility with a rotation schedule, if they already know how to do something, or they've seen it, or maybe they work in the lab and they're assigned at that bench as a student employee, you don't have to spend time on that bench with them as a student, but look at their weaknesses. What have they not seen? What do they not understand? And really focus on that. That will really tailor that learning experience to the student's needs, and they're going to be more satisfied. Just that recognition that the student is nervous, they're new here. Yes, they have some basic knowledge about what's going on, but they're still learning. And to make them feel comfortable where they are as a learner is really important to increasing their satisfaction with their learning experience and with their overall experience in the laboratory, such that they will want to stay and work there. So, in summary, the clinical practicum experience is an important learning experience for the students in several different ways. And we have an opportunity to evaluate the fitness of students for employment during their clinical rotation, but the student also has the opportunity to evaluate us as fitness for employment. And we can't forget that second part of it, because if we do, we're not going to convert those students to employees. The clinical practicum experience can positively or negatively impact a student's decision. I think one of our limitations in our surveys is, we asked, what's the importance, but we didn't ask if the clinical experience was positively associated with their employment decision, or was it negatively associated, right? Because if they had a bad experience, they would not take a job somewhere. If they had a good experience, they would take a job. So we looked at, did it impact, but we didn't ask how. And the staff attitudes and that interpersonal communication. And, it's been called like the soft skills, right? And yet I think people are changing that because those soft skills, your communication, your flexibility, um, and personality, your engagement with other people, are really the factors that people are that employers are looking for the most in an employee. Providing a positive learning experience for students in which the students feel supported and welcome increases absolutely the likelihood the student is going to want to return as an employee. And whatever you can do to make that positive experience happen will be, I think, well worth efforts, and not just in converting your students to employees, but retaining your current employees. So I'd like to acknowledge my collaborators here, Raquel Carter, Rocky Carter, and Robin Carter. Were both students in the program who did these surveys and analyzed the results. And then my faculty colleagues who helped with these projects, Dr. Nadine Lorette and LaDonna Moreland. So thank you very much. And I hope that you will take this information and use it to increase the learning environment in your laboratory and increase the positive staff interaction, not just with students, but with each other to make the laboratory a better overall environment. Thank you.